What happens if a baby is born prematurely? What happens when a baby enters the world weeks or even months before the expected date? For most parents, pregnancy is a journey measured in weeks. Every week gives the developing baby more time to grow, mature, and prepare for life outside the womb. But sometimes that journey ends earlier than expected. A baby born before 37 completed weeks of pregnancy is considered premature or preterm. And the earlier a baby is born, the more likely it is that the baby will need specialized medical care. But what exactly happens when a premature baby is born? Why can breathing be difficult? Why might the baby need to stay inside an incubator? And what happens during the weeks or months that follow? Let's take a closer look. The moment a premature baby is born. When a premature baby is delivered, the first priority is making sure the baby can breathe, maintain a stable heartbeat, and stay warm. Medical professionals immediately assess the baby's condition. They check breathing, heart rate, oxygen levels, body temperature, and other vital signs. Some premature babies can breathe on their own. Others may need help. Depending on how early the baby was born and how well the lungs are functioning, doctors may provide oxygen or use breathing support such as CPAP. In more serious cases, a baby may need mechanical ventilation to help move air into and out of the lungs. This is because one of the biggest challenges for premature babies is that their lungs may not yet be fully mature. Why are premature babies different? A baby doesn't simply become small when born prematurely. The baby may still be developing important organs and body systems. The lungs are still maturing. The brain is rapidly developing. The digestive system may not yet be ready for normal feeding. The immune system is still developing. And the baby may not have enough body fat to maintain a stable temperature. All of these things can make life outside the womb much more difficult than it would be for a full-term newborn. That is why some premature babies need specialized care in a neonatal intensive care unit, commonly called the NICU. Life inside the NICU. The NICU can look very different from a normal hospital room. You may see tiny babies surrounded by monitors, tubes, and medical equipment. But every piece of equipment has a purpose. An incubator can provide a controlled environment that helps keep the baby's temperature stable. Monitors continuously track heart rate, breathing, and oxygen levels. Some babies receive breathing support. Others may have feeding tubes because they are not yet able to safely coordinate sucking, swallowing, and breathing. For parents, seeing their newborn surrounded by medical equipment can be frightening. But these machines are there to provide support while the baby's body continues developing. Why can't some premature babies breathe normally? One important reason is lung development. Inside, mature lungs are millions of tiny air sacs where oxygen enters the bloodstream. Premature babies may not have enough surfactant. Surfactant is a substance that helps keep these tiny air sacs open. Without enough surfactant, breathing can require much more effort. Doctors can provide respiratory support and, when appropriate, medications such as surfactant therapy to help the baby's lungs function. As the lungs mature, many babies gradually need less breathing assistance. Why is feeding sometimes difficult? For a healthy, full-term newborn, feeding may look simple, but feeding requires several systems to work together. A baby needs to suck, swallow, and breathe in a coordinated way. Very premature babies may not yet have developed this coordination. Why do premature babies need to stay warm? A newborn's body needs to maintain a stable temperature, but premature babies have less body fat and may have more difficulty producing and retaining heat. That's why an incubator or other temperature-controlled equipment may be used. Keeping the baby warm isn't simply about comfort. Maintaining an appropriate body temperature helps the baby conserve energy for important processes such as growth and development. As the baby becomes stronger and can maintain body temperature independently, the need for this support decreases. If you're expecting a baby or have concerns about your pregnancy, don't wait. Book your online appointment today and take the next step toward the care you and your baby deserve.